I'm speaking to you today as a settler from my office, uh, which is in the traditional territory of the Anishinaabe, Huron-Wendat, Haudenosaunee, and Ojibwe Chippewa peoples, the land that is home to the Métis and most recently the territory of the Mississaugas of the Credit First Nation, who are direct descendants of the Mississaugas of the Credit. We recognize and deeply appreciate their historic connection to this land. We also recognize the contributions of the Métis, Inuit, and other indigenous peoples. We recognize the contributions they have made both in shaping and strengthening this community in particular, and our province and country as a whole. I wish to pay my respects to the many indigenous people who live and work here today. I acknowledge that many of you, if not all, have faced the pain of racism in your very own ancestral homeland. My name is Justice Barnes, and on behalf of the Association of Justice and Treatment Professionals, welcome to this year's Justice and Treatment Partnership Speaker Series. Over the next few days, we are fortunate to have esteemed experts to speak to us on different days on 4 topics, the last session being December 9th. Today, we are fortunate to have the expertise and to hear from an expert who we've heard from a number of times on the AJTP network, Norma Nicholson. Now, Norma went from a nanny to a dynamic nurse leader who attained a MA in education, a BA. She's a 5-time published author and founder of a non-for-profit organization. She's an Ignite Press consultant. Norma has demonstrated unwavering drive and genuine passion in positivity, impacting the lives of youth at risk and their families. As a public speaker, mental health advocate and mentor, she educates parents, organizations, and members of communities, local and international, about their responsibilities to ensure the well-being of adolescents. Due to her powerful influence on change, she has received many community accolades, which encourages her to increase volunteer outreach. She's actively engaged on governance boards, presents conferences and workshops, and assists heads of organizations with methods for heightening collaboration. Her vision for 2024 is to impact the lives of 1,000 youth. The topic is the successful reintegration of incarcerated persons into the community, that it requires having good mental and physical health. We will hear from Norma, and there's a Q&A. Please send your questions to the Q&A. And at the end of Norma's presentation, we'll have opportunity to answer the questions that you send to the Q&A. So with that, Norma, I'm going to share my screen with your permission, Norma. Should I do that now?
Yes.
All right, so I shall share my screen and hopefully I do it correctly. So share my screen here. All right, and let me move this. Okay.
Beautiful.
Yes, okay, Norma, over to you.
Can all our participants see the PowerPoint? Good afternoon on a sunny Monday. We're already December the 2nd. Today I have the opportunity to actually have a discussion with participants about what can we do as a society to ensure we have successful re-entry from prison or jail to the community for folks with mental and physical illness. And I'm focusing today on men because you could go in the jail with a mental illness and you're exiting with both mental and physical illness. Next, please. Next slide. What happened?
Can you see my slides?
You skipped to the third instead
Okay.
of the second.
Okay. Is this okay?
Here we are.
Yeah, there we are. Yes.
An example of having good mental and physical health is shown by Maslow's hierarchy of needs. And surprisingly, he starts at the bottom of this triangle that you're looking at. And it's our physiological needs, such as food, water, housing. And if those needs are not satisfied, we are just not able to move up to safety and security, love and belonging, self-esteem, and self-actualization. So let's focus with empathy and understanding about the person who presents with a mental illness and for some reason or the other ends up being in jail and then sent back to the community. Next slide, please. I'll share a short story with you, and this is true. A 24-year-old male, Michael. Michael was diagnosed with bipolar disorder. He had minimal access to health care, and that is one of the challenges we have in Ontario and maybe across other provinces. For someone with a mental illness, you can be in a hospital and you're sent home to be by yourself. And if you have another illness, you usually don't remember what you are supposed to do. So you can also have a mental illness and you are mentally healthy. I hope that's clear because many individuals are walking around today or working and they have a mental illness, but because they have followed through with their treatment, their therapy, what they're supposed to do, they can be mentally healthy. However, if you're not mentally healthy and your mental illness is taking over your life, sometimes it leads you into the justice system. I can imagine walking along any street, downtown Toronto, any street, and you will come across someone with a mental illness. You can hear the person talking to himself or speaking very loudly. And for some of us in society, we just walk by and criticize. So there is a stigma, which I'll talk about. And because of the crime that they have committed to make society a little bit safer, they are incarcerated. They are released and then they find themselves committing more crimes because there has not been any support systems in the community or even before they leave the jail to help them to re-enter. Next slide, please. So as I mentioned, today I'll focus on adults because amazingly young people, children, youth do have mental illness. Today, I'm focusing on adults because of the type of relationships that adults have. And some adults do have a physical illness, such as diabetes and mental illness. The criminal justice system is very complex. Don't ask me to explain step by step what happens. I'm sharing with you today my research and also being involved in the system as a leader in healthcare. Criminal justice system and healthcare are very complex structures. The media's negative impact on someone who has a mental illness And we need to look at if there could be successful re-entries to the community to lessen recidivism. So when I say successful re-entry, I cannot think of 2 to 5% of individuals having mental illness, being incarcerated, and had a successful re-entry to the community. Next slide, please. No one chooses to be physically unwell. You could wake up today, you're not feeling well, you went to the doctor, and lo and behold, you're diagnosed with some kind of disease. And I don't have to go through a list of diseases because you hear them every day, you read about them, you have family members that has medical diseases. And I'll just think of diabetes. Physical health limitations could be someone who had a stroke. They can no longer go up the stairs. They have to move. Family conflicts happen all the time. And for a lot of people, when they're not able to resolve those family conflicts, they themselves do get unwell. Unemployment, we hear a lot about that since COVID. There are many financial needs. And for people who are really trying to find jobs and they cannot find a job, perhaps they will become unwell, even getting anxiety, depression. They need to pay their bills. Socioeconomic disparities. You hear of individuals who live in low-income facilities, living in poverty. They do get physically unwell. Next slide, please. No one chooses to have a mental disorder or a mental illness. Disorder says that you have been diagnosed. A psychiatrist or a psychologist or even your family doctor could say you have a mental disorder. If you have anxiety and depression, it is a mental illness, but it may not be called a disorder. When you have a mental disorder, I'll go back to bipolar. There are times when someone with bipolar could be living a normal, stable life, going to work, enjoying outings, relationships, and then something happens where their emotions spiral out of control and they lose touch with reality. They're not able to reason and make judgments of their situations. You could actually see someone walking in the middle of the street and holding up his hand, and he doesn't want to stop the traffic. It's just what is happening in his brain. Lack of ability to reason, emotional outbursts. I've been on the subway and there was someone sitting behind me and he just started singing and making a lot of outbursts, and he was walking up and down the aisle, and you can see people really fearful. You can see the fear on their faces because they do not know what will happen next. And because some of these folks want to calm whatever is happening, amazingly, they end up engaged in substance abuse, whether alcohol or taking too many of the tablets they are prescribed, or taking tablets or injection devices from individuals that are trying to help them. Someone with a mental disorder may start feeling guilty. That's where I call self-stigma, worthless, hopeless. They don't trust individuals around them, and then they lose their family structure and their friends. And then they have to deal with self and societal stigma. Next. Dr. Warren Alpert of the School of Brown University in the United States, Warren Alpert School, rather, Christine Montrose, is a psychiatrist and an author. And when I read this quote from her, the impact of incarceration for the mentally ill. She says, incarceration in North America routinely makes mentally ill people worse. And just as routinely, it renders stable people psychiatrically unwell. She concluded by saying our system is literally madness. Because how can you incarcerate someone that may be out of reality? They don't know where they are. And for those that routinely go in and they're quote unquote stable people, they come out psychiatrically unwell, depression, PTSD, many kind of disorder because of how the system within the jail works. Next slide, please. So I want you to ask yourself today, why are so many people with mental illness placed in jail? Take a moment to reflect on that. And I have placed here a few points of why they would be. They do commit crimes. I'm sure you have read where maybe a son or a daughter or a family member, which is very sad, injures another family member or even kills them. So they do commit crimes, and it is for the court to reason what to title that crime, second degree, first degree assault. And when they are incarcerated, that's when there's an opportunity to look at what do we do with this individual. In my mind, they should be helping them. But as we carry on this discussion, you can see why the courts have a challenge to get someone ready to re-enter the community unless there's a circle of care. When we listen to the media does share some good stories, but the media exaggerates some of the reporting. And why not? If you pick up the newspaper or you're listening to the evening news and they don't do that, then maybe someone will get up and say, oh, there's nothing here to listen to. Stigma and societal views. There are three kinds of stigma around someone with a mental illness. I mentioned briefly on the first slide where it says, I hate myself, I feel hopeless, and that is self-stigma. We also have the stigma of the media, what they report. The media contributes to the stigma. They bring fear into individual. Don't go in this community because that man just killed his mom, and it is said that he has a mental illness, even if the forensic psychiatrist has not yet made that diagnosis. From what is reported in some media outlets, someone with a mental illness is ridiculed. They can be even comical portrayal. If you look into some of the cartoons in the paper, you'll see there's a comic portrayal of someone that is mentally ill, very insensitive, And because the media contributes so much to our daily life, society begins to take on some of what is portrayed and stigmatize the person with the mental illness. So can you imagine you're stigmatizing yourself, you're stigmatized by the media and society. Many aspects of our society stigmatizes someone with a mental illness. And if you really reflect whether you are working in public service or working in healthcare or in the justice system or working in an office with legal aid, you have come across someone with a mental illness. It could even be a family member. And as I said before, no one chooses to become mentally ill. So we have self-stigma, the media creates stigma, and society and a human being has to deal with that. Then it comes to funding for a lot of services. We hear X number of dollars being given for a mental health clinic here, or it's given to a larger institution for research, but there is not timely allocation of fund in our healthcare system to manage the healthcare of someone or people with mental illness. So what life do we expect them to see? I was a nurse for many years, and when I led the team on a psychiatric unit at one of the hospitals, we had like a fact sheet for the individual to take home so that someone can help to check off what they're supposed to do and when they're to come back. Many times they did not ever come back for their appointment unless someone picked up the phone and called, because their relationship have been broken in the community and no one comes alongside them. So there's not enough funding to have a circle of care. Very minimal. Someone may be diagnosed with a mental illness, goes back to the community and has to find a physician. And you have heard of the shortage of physicians, medical physicians. So one can imagine there aren't that many psychiatrists, and you may have a first assessment without paying, but where do you come up with the money to pay for those services? Unless you're able to go back to a large institution that has lots of wait lists and perhaps lots of traveling time. There's not enough resources for prevention. Many people who are mentally ill and go into crisis, it's because there aren't people around them that recognize their situation that can say, I'd love to accompany you to see Dr. James today. I see you're not feeling well. And as a friend, I want to be there for you. Many individuals are fearful of someone with a mental illness. Therefore, they get more ill, and until there is a crisis, no one comes alongside them. The National Alliance of Mental Health in 2020 said that we release individuals from jail and we release them. They are now in the revolving door of the justice system. Where would they find housing? They live in shelters, and sometimes because of the behaviors that emits from the mental illness, They cannot even stay in the shelter. So you will find that many individuals that are highly, highly ill with mental illness, they're actually on the street or somewhere in those tent cities. Why aren't we as a society looking at ways that we can impact the systems so that individuals with mental illness can get the support they require so that they can live even with the physiological needs that Maslow has shown us. Next slide, please. As the psychiatrist says, jails are not set up to ensure prisoners are healthy. Can you think of why we have jails? Maybe put one statement or one suggestion in the Q&A. They're not set up. From the knowledge I have gained from managing healthcare for young people in a severe, secure youth custody, as you all know, youth are treated very different from adults in those settings. But for adults, jails are used for retribution or punishment. Jails are used for removing individuals from society to reduce the harm that they may cause. Jails are used as deterrents for potential offenders. And in a few cases, jail is used for rehabilitation. So they're not set up to ensure that each individual that is incarcerated is kept healthy. In fact, incarceration brings many negativity on the lives of individuals. You do not even require to have a mental illness if you're incarcerated and you're returned to the community without even an identification card like a HOHIP. You have no bank account. You do not feel very healthy. The psychological toll of incarceration, no relationship. I've seen families that are so tired, they cannot do anything but walk away for their own sanity, because a person that is very highly ill may just refuse to take their medication and say, I feel fine. And you're not going to be calling the police officer to come and get someone to the hospital if they're just saying, I'm not taking my medication. But what does that lead to? Build-up of crisis. So there is a real psychological toll on someone that's incarcerated, whether you're entering with a mental illness or you're entering with both a medical and a mental, and of course you have to commit a crime. Many releases have a complex web of factors to manage. So can you imagine having a mental illness, a medical illness, and you're being released from jail? You may have been there, maybe you have been sentenced, maybe you have been held in custody in remand, but you're released and you're told to see your doctor. Maybe if you were fortunate enough, and I'll talk a little bit about the mental health courts that we have which are excellent. But many releases, there are so many things that have to be addressed. In fact, in the United States, when anyone is leaving jail and they are aware that they will be discharged, like the social workers or the team inside the prison, they have what is called a prison release fact sheet. I don't know. I searched and I couldn't find that we had one in our jails in Ontario. And it would be who can help that person. So without addressing those complex factors, it contributes to the churning of individuals through the justice system. And of course, recidivism is what we call it. There are so many stories about individuals who are locked up in jail. They get bail and they're out in the community. Their illness have not been addressed. Could have been one of the root causes of the crimes. And then they do a crime again and they're just in that revolving door. Next slide, please. So I want us to look at, there are many themes for successful reentry, but what I've decided to do is just to go with the research of what several places have used, and they still haven't gotten it right. How do you prepare someone for release while that person is incarcerated? It could be, and I'll talk about this in more detail in another slide, as simple of having the psychiatrist reassess that individual to see if he or she is capable or he's capable of living in the community and what supports there would. If that person does not even know how to manage priorities, like what will I do first? Will I get someone to help me to get a HOHIP card so I can get health care, get my medications renewed? If they're not able to manage those simple priorities and the larger ones such as housing, money, where will I live? What is the impact of support after one is released? Remember, we're talking about individuals experiencing a mental illness. What are some of the obstacles? Influence of personal identification. If you have no HOHIP, you have no driver's license, you may have a birth certificate, you don't know where to find it. How would someone know who you are, even if you say? And with all those emotions and uncertainty, how does someone with mental illness has a successful reentry to the community? Fails many times. Remember, when someone is incarcerated, is in jail, they're living maybe with another inmate or they're in a small cell, or if their behaviors cannot be managed well, they're actually in isolation. Lights may be on most of the time. They have their meal where they sleep. and then we're releasing this person back to the community, raises a lot of concern. Next slide, please. What does the future hold? Can you think of something that you can do as an individual in our society to reach out, educate yourself if you're not sure of what to do? So could the way be paved for policy and structural reforms? There is this opportunity for mental health court. There are not sufficient number of judges that the media has right. There are not sufficient numbers of forensic psychiatrists. I am not even sure that we have adequate numbers of mental health support workers in the court. So for the justice system and justice reform, issues for public safety, who is going to listen to say, we need to have more judges, we need to have more lawyers that have had special training and sensitivity around the mentally ill? Can individuals speak up in the justice system? And I know some retired judges have, but we need to get together and even ask the public to support the healthcare system and the justice system and develop different policies for structural reform. I personally feel from seeing what happens with someone who's mentally ill is that they can't manage just being sent back from a hospital or sent back to the shelter or even to a family member without some supports for that family member. How about the mental health courts? There is a pathway into the mental health courts, which is usually decided by the Crown and the mental health support workers and the judges. And for those individuals, they receive a bit more support in the community and they're followed up. Why can't we have more mental health courts? It's going back to where would the lawyers come from? Where would the judges come from? Why can't we look at sensitivity and caring through the hierarchies of our government in order to make sure individuals keep well? Remember, no one chooses to become mentally ill. And then I talked a bit about the role of the media, communities, and business. There are some business that they would never hire someone if they become aware that that person have a mental illness. In fact, without the human rights, some organizations will say goodbye to the individual who has a mental illness. And what about community assistance programs? There are many of them. Some do not collaborate with each other. so that you can have consistency in the service that is offered. As community alienation, please, if we are not aware of how to speak to someone having a mental illness or how not to speak, please obtain some education and share your knowledge with others. We need to have more psychiatrists being able to attend these mental health courts so that we have a team, we have a social worker, we have even a legal aid worker in the courts so that documentation and assistance can be provided. We as a society, we can help the future for not only ourselves, but the future for individuals that become mentally ill and are involved with the justice system. Thank you for being here today. I can take a few questions, and I thank Justice Barnes and the Association of Justice and Treatment Professionals for allowing me to share some of my knowledge today.
All right. All right. Yeah. Any questions there? Norma, I'll just let you run that because you. Are there any questions for Norma?
I don't see anything.
Okay. I
Maybe
saw a note thanking you for a very informative presentation, which is
thank
helpful.
you.
You're getting accolades, people saying thank you, which is great. I want to thank you. I don't see any questions, and for me personally, your presentation was so holistic. I don't have any other questions. I was going to ask you some questions myself, but I don't have any. It's well-rounded. You're able to provide some ideas for how we can continue to improve in terms of the work we do, and we appreciate that. So I'm not seeing any other questions. So for that, Norma, I just want to thank you for taking time off your busy schedule. You are a sought after presenter, and we appreciate the fact that you spent time with us this afternoon. I see TJ was asking whether or not you could provide some of the books that you wrote. I do not know
Well,
what that means.
two books I would highly recommend. I'm a nonfiction writer. I do not write fiction, so all my books are true stories. And having been a healthcare leader in the largest youth custody facility in Ontario, one of my books is titled End the Incarceration of Black Youth. And Indigenous youth, they're very overrepresented in the justice system. And I'll leave the stat with you today is that 42% of young people admitted to youth in custody are diagnosed in there with a mental illness. They are supposed to be diagnosed in their community, but it's when they are incarcerated that they are diagnosed. So, end the incarceration of young people will talk in depth about the trauma, about why young people are doing what they're doing. And young people these days, they used to say 12 to 17. Now they're looking at the brain that is still growing up to age 24. And the next book is One Life, You Can Make a Difference. And it talks about my life and what I have done to help people change their lives. The others are children books. Thank you for asking.
Norma, thank you so much for sharing and for giving of your time. You do this voluntarily. We appreciate it. And as you can see in the chat, there's so many people saying thank you very much for an insightful and trauma-informed presentation.
And
With that,
please go to my webpage. My webpage is www.normaFnicholson, Nicholson. There are many articles there, and you can also connect with me if there's a question you have around mostly youth justice, but I also speak to justice and adults and healthcare system reform.
there we have it. So with that, Norma, thank you very much. And on behalf of everybody, thank you for attending this most important topic. Tomorrow there's another topic, but today, thank you very much, Norma. Norma's remarks will be recorded, and it's recorded and will be sent out to everyone who registered. So thank you. So with that, have a fabulous and fantastic afternoon, and
Thank
until next
you.
time.
Thanks, Justice Barnes. Goodbye, everyone.